Hi, everybody. Welcome to the City of Hammond's second COVID-19 task force meeting. We started once we were placed in the red by Governor Holcomb and further placed, even further restricted by the Lake County Health Department. We decided to hold these meetings weekly. Last week was our first meeting. And this is, we're doing it weekly on Wednesdays. I don't anticipate this being an extremely long meeting because, not much has changed really since last week. I do want to go through and speak to the medical professionals. We have representatives from Comprehensive Care here, Dr. Frank Masana. We have Emily DeMario from Franciscan Healthcare Center, Hammond, that we're going to be speaking with. I have the school superintendent, Scott Miller, on the line, various representatives from Hammond City government, and obviously myself. But last week's meeting, we talked about the restrictions placed upon us by Governor Holcomb's order. The Lake County Health Department went a step further limiting restaurants, shopping centers, bars, nightclubs, things of that nature last week, and nothing's really changed since then. But before we get started on this meeting, I do want to start with our medical professionals. I'm going to start this week first with Dr. Frank Masana of Comprehensive Care, located in the city of Gary, right on the Hammond-Gary border, across what we call in Hammond 169th Street. How you doing, Dr. Frank?
Good. Good morning, Mr. Mayor. How are you?
Can I say one more thing also? I want to remind everybody that we have Lori that's interpreting for us, for the Hammond residents that can't understand us. So please, when we all talk, try to talk slow so that Lori can keep up with us and help communicate to the residents that have trouble hearing. So, Dr. Frank, thank you again.
Absolutely. Like you said, there's really not a lot different from this week to last week. A little bit more closer to the vaccine actually being approved and distributed. I expect that'll happen next week for the Pfizer-BioNTech vaccine, and then Moderna probably the following week, which sounds like it will give us around 50 million doses by the end of the year, which is really equivalent to 25 immunizations because it's a 2-dose vaccine. There's 10 others in late stage trials. I don't know what those results are going to show, but it's very likely that by April of next year, it will be available for the general public to receive the vaccine. So that's all very encouraging. The results seem to be encouraging. I can't give you much information on the specifics of the vaccines because they haven't released the information from Pfizer. Until the FDA approves it, they won't release the trial specifics. So I'd like to see that before giving any kind of thoughts on it. But so far, it seems like it's going to be very positive and safe and efficacious.
Doctor, could I ask you a question as a doctor?
Yep.
I talk to a lot of people and, I hear about the anti-vaxxers and the people that are nervous about taking this medication, this vaccine, once it's available, which astounds me in the midst of a pandemic that people are that skeptical of government. I was wondering if you personally are going to accept the vaccine once it's made and what's your opinion on this type of thinking that's out there? It's out there in pretty legitimate numbers also.
Yeah, unfortunately, there is that out there. At this point, I personally do plan on receiving the vaccine. I have not seen the official data from the manufacturers. I'd like to see that before giving my final, thoughts on it. But from everything I know about it, I would absolutely have no hesitation in receiving it. The Pfizer and the the Moderna vaccine are new in that they are an RNA virus, and it's never been, we've never used that type of technology to create a vaccine. And to try to just explain that really briefly is it's, the virus is actually an RNA molecule, and it gets into our system to replicate itself. It uses our own cells to replicate itself. And the vaccine works in a similar manner in that it stimulates production of antibodies, our body to produce the antibodies that target a specific weakness in the virus. And then it kind of burns itself out, just like any other virus would do. So it's a fascinating method, and it could revolutionize the way we actually vaccinate people in the future. So there's still a little bit of unknowns about it, but yes, I intend on receiving it if everything checks out the way it seems to be at this point. Absolutely.
Okay.
And I absolutely find it unfortunate. That's just my personal opinion, that it's unfortunate that this whole pandemic happened in an election year, because I think politics got involved unnecessarily on both sides. And some of the fears of the vaccine probably came from that, as well as the longstanding anti-vaccination group that is, prevalent in our country. We haven't had mercury in vaccines forever and a day, so there is no risk from that, and that was the biggest issue going.
Would you have your kids take it, Doc?
I'm sorry?
Would you have your kids take the vaccine?
Interestingly, there has been no studies on children for the vaccine, so they're not approved for children at this point. So they have not done studies on children under the age of 18, and they're set to do those trials. So I don't expect that it will be approved for children until later in the year next year. But knowing what I know about it at this point, I would.
I think that's important to hear as a doctor, that you would let your own kids get vaccinated, and obviously you care deeply about your family.
Oh yeah.
So I think that's important to hear. I hate asking you questions, putting you on the spot like that, but I think it's important for people to hear a doctor say that. But I would have my kids take this vaccine. I think that's important to hear.
Yeah, I just do want to see the actual data, and I want them to complete the trials on the the pediatrics. But from what I know now, absolutely, I would have no reservations.
Great. What else? Do you see COVID patients in comp care? I mean, do they come in? Do you test them before you work on them for occupational injuries, or is it?
No, we don't do testing here, and we don't. We pretty much have a policy: if you're sick, you can't come in.
Right.
You need to get tested. We're just not set up for that. If you're going to do that, you have to have an area that is isolated and separate, so that you don't mix potentially positive patients with the general population. Our building's just not set up to do that, so we don't.
Okay. Well, I appreciate it, Doc. You got anything else you want to report this week?
No, not this week. I will tell you. I'm sorry.
I really appreciate you being here. I think it's important. I know you have a lot of things you could be doing, so.
It's my pleasure. I appreciate it. I just before I forget to tell you, I won't be available next week, though. I'm sorry. After those kind words, I won't be available.
I take it all back. Sorry.
Sorry.
All right. Thanks, Doctor. It's good to see you. And if we don't have you next week, I'll see you the week after, hopefully. Okay.
Yes, absolutely. Thank you.
All right. Thank you very much. Okay. Next, we're going to go to Emily from Franciscan Healthcare Center, Hammond. How you doing, Emily?
Hi. Good morning. How is everyone?
Great. Thanks for reporting. Did you hear the question I asked Dr. Frank about would he personally take the vaccine? Could I ask you the same question, being in the medical field?
Yes, I would. I would get the vaccine.
Because you hear people talking like that, right? Right, Emily?
Oh yeah. I would get it, and I have, suggested as soon as it's safe and available to my family for them to get it as well.
I think it's different for you and for Dr. Frank that are on the front lines, and you see the stuff that's going on right now, to hear the rhetoric coming from America about whether or not they take the vaccine. It's got to be crazy in your mind, right?
Yeah, I mean, I could see the worry that people do have of getting the vaccine, but I think the biggest thing is it's not live. You can't get COVID from the vaccine, so it's a protective measure that I think that people need to know is available for them when it is available for them.
Okay. Thanks. Yeah. How's everything going at Franciscan Healthcare Center?
It's going day by day. We're going. Our numbers as of Monday, November 30th, in-house positive 38 COVID, rule out 27, discharged home 751, and deceased 81. As of this morning in our ICU, we have 3 positive, 4 rule out, 1 on a ventilator that are all COVID. And then they are adding more negative pressure rooms, both in ICU and our telemetry floors. So that's good to hear.
Are these numbers steady, rising, lowering? I mean, I know last week you reported the numbers. I forgot the numbers, but are they steady? Are they going up? Are they going down?
The in-house right now is increasing from last week was 27 in-house, and as of Monday morning, 38. Our numbers get updated Monday, Wednesday, and Friday. So they have been steady and increasing. Yeah.
Yeah. And it's pretty much, I mean, because where your hospital is located, so you get a lot of customers from, a lot of patients from Illinois and Hammond and East Chicago, all around this whole area, right? So you can't really say it's all Hammond. It's just patients in your hospital.
Right.
Okay. How about occupancy? We hear a lot about that on the news, about ventilators available and occupancy rates. Like, is there room left in the hospital? Are you guys jam-packed?
It is very full. We have been holding in the ER a lot, patients waiting to go upstairs. So it is very full. We do our best to kind of make sure things move along and accommodate, but it has been a rough start to the winter.
Yeah. So when do you anticipate, I imagine Franciscan Health is going to be one of the locations for the vaccine to be distributed, correct?
They are working with the health department, I do know.
Okay. So it'll come through the health departments or it'll come through the hospitals?
It would come through the hospital. I know that they are working with the state of Indiana and the local health departments, and they're doing everything they can to, protect us and protect our patients and city of Hammond. So they are working on it.
I appreciate it, Emily. Do you have anything else you want to report this week?
No, not really. Just that, we want everyone to keep wearing their masks and washing their hands.
I appreciate it. I appreciate you and Dr. Frank very much. Thanks for being here, and I'll see you next week.
Thank you.
Great. I'm going to go next to the City of Hammond School Superintendent, Scott Miller, who I appreciate being on the line as well. How you doing, Superintendent Scott?
Doing very well. How are you, Mayor?
Good. Thanks for participating in this with us. I know it's very important for a lot of residents to know what's going on in the schools. And I know you guys are all virtual at this point, but you still have the teachers coming to classes. Is that true?
So it's the teacher's option. We decided early on that a teacher could best determine whether they wanted to teach from their classroom or better for their home. Some teachers, childcare is a legitimate issue. They have their own kids in things. So we wanted to provide them that flexibility. We still do have some of our students with the greatest special needs are coming into the buildings for school. We still are operating our 3 safe zones, and the Career Center is still running as well. But other than that, the other 95% of Hammond students are still doing the full-time e-learning. The only updates I would have this week, Mayor, is last week I didn't mention, we do have a School City of Hammond COVID tracker right on our homepage. So anybody who's interested in seeing the impact on how COVID is affecting School City of Hammond, all that data is right there and easy to see on our homepage. Last week was our worst week yet as far as impact goes, with 170 total students and staff on quarantine and 74 positives between students and staff in just the last week. So it's definitely been the most significant thing. If you look at the chart, it's really gone up over October and November compared to the start of the school year. One other promo I'd just like to, go ahead.
Your students and staff are obviously catching this from home then, right? They're not catching it in the schools, obviously.
Correct. Yeah, we're not seeing any spread from the few kids who are in the buildings. We're seeing it from home. And it's, I always say it's a reported number because frankly, for students, a lot of it's those who might be involved in extracurriculars. If they're doing full-time e-learning, they're probably not calling the school to say, hey, my child has COVID, because it's not impacting anybody else. So it's a reported number. It actually could be higher because of all the kids on full-time e-learning. Just one promo thing. We are still trying to continue our arts program. So the Hammond Academy for Performing Arts, next Thursday at 7 p.m. we'll have our virtual Kappa Holidays. You can find more information on that on Facebook, and we'll be promoting it as well. But a free event, you can jump on and see some of our kids performing in their Christmas and holiday musicals. So next
Thank you very
Thursday,
much.
7 p.m.
We appreciate it, Superintendent Miller. Thank you very much for participating.
Thank you. Happy to be here.
Next, I want to go out to the Hammond Parks Department. I see Jim Talon out there. Can you unmute, please, Jim? Jim, we have a couple events coming up that were approved by the Lake County Health Department. Well, we have, I guess a couple events coming up this weekend approved by the Lake County Health Department, the Santa Sprint and the Christmas Parade. I was hoping you could speak about them. And another thing that was approved by the Health Department that we held on Friday last week was the Christmas tree lighting. And we did our social distancing and we still pulled off a really nice event in a completely safe manner. So I appreciate the Lake County Health Department helping us with that and approving our upcoming 2 events. Jim, can you go into a little bit more detail about them, please?
Yeah, absolutely, Mayor. They did approve our holiday parade, which will be this Saturday, starting at 10 a.m. It starts at Gavitt and we'll be finishing at the Sportsplex. And then there's a Santa Sprint, which is a 1-mile run that will start, I believe, at 9:30. Right before the parade, and that was approved as well. And just asking people along the parade route, obviously, to take social distance into effect and wear masks when necessary. But yeah, both of those were approved.
The Santa Sprint is its first annual, right?
First annual, yes.
So it's the actual parade route is the run?
I believe it starts at 175th. You can go to gohammond.com and check it out, but it will start half hour before the parade and does finish at the Sportsplex as well.
175th and what, like the boulevard to the Sportsplex?
Indianapolis Boulevard, yes.
Gotcha. So how often do you get a chance to run right down Indianapolis Boulevard, right?
Correct, yes.
Right, legally anyway, so.
Right.
Yeah.
Yes.
So we got the Christmas parade coming up and the Santa Sprint coming up both this weekend. Technically, under Lake County's initial order, we could not have held that event because it would have more than 25 people there unless we were approved by the Lake County Health Department with our safety plan. You submitted those plans through the through the Hammond Park Department, and they were both approved, right, Jim?
Correct, yes, sir.
All right, I appreciate it, Jim. Anything else coming up?
We will have the signs. You mentioned signs for the parks. We had the signs that are being created right now, so we will have some of those. No gathering over 25 people should be going out into the parks maybe later this week, if not early next week.
How does the Lake County Health Department's order affect the Sportsplex, the Shepherd Center, and the Civic Center, Jim?
Well, we submitted safety plans for all of those facilities, and they were approved as well. So we are allowed to have tournaments there. There will be people there for minor athletes that are playing. They're allowed 1 parent to come in along with the coaching staff. We're asking social distance. Obviously, we separate fans. A lot of times fans will be upstairs, not down. And then as an additional precaution, our tournament directors are asked to submit a plan to us for them specifically. A lot of people don't realize that the city of Hammond are not running these events. It is a tournament director that'll be running these events, and they kind of handle it, and they use our facility, and we're there to support the event. So they also submit a plan to us, things like wiping down the scorers tables and the team benches and things like that between games, wiping down the basketballs, things like that all take place, and they submit those plans to us. So it's an extra, I guess, layer of protection for the people that are coming to the Sportsplex.
Okay, so if you have questions about what's going on with your team or your league at the Sportsplex or your tournament Sportsplex or the Civic Center or the Shepherd Center, just call ahead and they'll give you the update, I imagine.
Correct. Yes, sir.
Okay. Thank you very much, Mr. Talon.
Okay.
Hey, Superintendent Miller, can I come back to you on a sports-related question?
Please do.
I talked to somebody that knows a lot about high school basketball, and they told me what an amazing team Hammond High is going to have this year. And I was wondering, with the pandemic in the background, how that affects our winter sports that are coming up, the wrestlings of the world, the basketballs of the world, boys and girls. And, obviously, this is the last year Hammond, Clark, and Gavitt are going to have basketball teams, in their respective schools. So I was wondering how you were all approaching that with the school city.
Sure. So we're taking our lead from the IHSAA as far as the guidelines for how to run practice and competition. The governor and Dr. Vavilala put out guidelines about the actual events. I think I mentioned last time we are investing in a system that allows us to stream the games so people can still watch them from home, since only family at this time, as long as we're red and as long as Vavilala's order is in effect, only family members are able to attend the games, no one from the community. So we still want to be able to stream. That's important to me as well for some of our student athletes to get exposure from scouts, because scouts will not be able to attend the games as well. As you know, many of our athletes do get next level scholarships. It may not be D1, but D2, D3 a lot of times, and we want to make sure that that footage is available for colleges to see and highlight our student athletes. So that's kind of how we're handling right now. Obviously, if things get better, we can, and those restrictions lighten up, we can get the community back to some of these games. But right now, it's family only, and look for streaming coming soon.
All right, thanks very much. And Superintendent Miller, I'm a Notre Dame football fan, as you know,
Oh, yes.
and I know it was a Morton High School student that went and transferred to Maryville for this season,
Yeah.
is just signed with the University of Notre Dame Fighting Irish football team. So that's a Hammond kid that's going to play for the University of Notre Dame. So
That's really great. I mean, the whole thing is unfortunate. I mean, hate to have kids transfer, but I don't fault them at all. I mean, we thought the best move to start the year was not to have athletics, and I know you agreed, and we talked about that at that time. It's still a risk. I mean, there's a level of risk in every decision that we make right now, but the kids need to live their lives, and for a young person who has the talent to play at the next level and get it paid for, I mean, it's hard to fault a kid for doing that, and I won't. And congratulations to the
and Scott, like, I know that was a tough decision you made, but look at what's going on in the NFL and in college football right now. I mean, there's no doubt you did the safe move, which I think any superintendent would want to do the same thing. But like right now, there's the Denver Broncos couldn't even field a quarterback because all of them have COVID. So like,
correct.
Obviously you can pass it along on the football field and in the locker rooms, and they are. So I don't fault you a bit for the decision at all, because that's a tough seat you're sitting in with decisions like that. So
For sure. Thank you.
all right. Thanks, Scott. I see Kevin Smith out there. Kevin, I know that we don't need to go through again. Kevin's corporate counsel for the city of Hammond. I don't think we need to go through exactly what Governor Holcomb's order said, but I think we do need to focus a little bit on the Lake County Health Department's order, and because there's people from the business community listening right now in Hammond, and the Lake County Health Department made the decision to go further than Governor Holcomb's order. And basically, how does that affect restaurants and businesses in the city of Hammond, Kevin? That's the only thing I really want to focus on, is how much tighter we have to be because of the Lake County Health Department's order.
Sure, Mayor, and thank you. Just a reminder, I guess at the outset, the governor's orders always say, every executive order he has put in place since the pandemic was declared a state health emergency, he indicated that local health officials, be that a county health department, which governs the city of Hammond, or a city health department, in some instances, could place further restrictions on the residents of that area. Another thing I want to mention, Mayor, at the outset, he did extend his order through the end of the year, December 31st, so that impacts things like board meetings and things like that. They can still be by Zoom and other issues. So that was extended through 12/31 yesterday. Specifically, Mayor, to your question, in other words, what did the Lake County Health Department do that made things more restrictive? What Dr. V did specifically was to give percentages to certain types of businesses as to how they can operate. And what she did was, for example, shopping malls, stores, liquor stores, convenience stores, 75% capacity. Bars and nightclubs are 25% indoors, 100% outdoors, and must close at midnight. Restaurants and other retail food establishments are 50% capacity indoors, 100% outdoors, must close at midnight. Tables must be 6 feet apart. No self-service buffets or salad bars, and customers must remain seated and cannot congregate. If you have to get up, you have to put your mask on. It's also always a good move, I think, with serving personnel to wear your mask until they come and leave the table. I think that's just a courtesy to those workers. But that's not mandated, but I guess that's just my opinion, Mayor. I'm sorry about that, but that's just as an aside. Also, personal service places like salons, barbershops, nails, and tattoo parlors are by appointment only. Funeral homes, 50% in public areas like for a wake or a viewing. Gyms, fitness centers, yoga, dance, martial arts, 25% capacity. And ensure social distancing in any class size to 10 feet. So that would include places like the Civic Center, fitness center. And lastly, movie theaters, bowling alleys, and marinas are 25% and have to close at midnight. The other thing that they mentioned for any pre-planned social event, and I know this affects things like, for example, at the Gene Shepherd Center, like a birthday party or anything like that, that was approved under the guidelines. The health department is asking that the facility ensure that it's no greater than 25% capacity, and also that if it's pre-planned, that a guest list be kept by the facility so they can be given to the health department in case they need to conduct contact tracing. So that's where we're at in the county, Mayor.
So Governor Holcomb originally came out with his executive order, and then it was followed with a tight and leaving us in Hammond with the ability to go tighter than Governor Holcomb, but we couldn't go with looser restrictions than the governor's orders, right?
That's correct. It allowed local health officials to go tighter.
And then Lake County Health Department stepped in and went tighter than Governor Holcomb's order. Then, meaning in the city of Hammond, I'm really not driving the bus at all at this point.
That's
we have
correct,
to follow Lake County's order. We can't go looser than Lake County's order, but we can go tighter than Lake County's order, correct?
That's absolutely correct, Mayor. So that's why, for example, as you mentioned with Jim Talon, the city had to submit safety plans, which it did because it's under the authority of the Lake County Health Department, correct?
So, not saying that this is going to happen, but if the Lake County Health Department decided that they wanted to go even tighter and they completely shut down Hammond's economy, Lake County's economy, they could do that, correct?
They could go to a total shutdown if they felt that was appropriate. That's correct, Mayor.
Even if I, as mayor, strongly felt that that was a mistake, they could still say, it doesn't matter, Mayor McDermott, we're shutting down the economy. They have the ability to do that legally,
As the
right?
county health officer, she has the ability to do that. That's correct. Under the governor's orders. The governor said and gave that ability to counties and localities.
So, right now, the governor, okay, so she can go tighter than the governor, and there's nothing I can do about it in Hammond at all.
That's correct. We have to follow those rules. We can submit safety plans, which we did.
And Horseshoe Casino is still unaffected by these orders, and they're still open for business, right?
Yeah, interestingly, I received a call late last week from one of their general counsel, Tim Lambert, who requested our assistance to make sure that the county health department gave them the permission they needed to continue operations, which happened last Friday. So they're good to go under the state's orders.
Okay. Anything else, Kev?
No, sir. Thank you, Mayor.
I appreciate it. Thanks for coming on. I have two Hammond Council people in attendance right now. Councilwoman Katrina Alexander. Councilwoman, do you want to say anything?
Just continue to stay safe, everybody, as we are in holiday season. The weather has changed. Flu season is definitely here. I just continue to encourage you as we go through this, that you're wearing your mask, washing your hands, and continue to social distance. I know we have the parade coming up. Even wear your mask out there because it can travel in the wind. You just don't know. So it's better to be safe than sorry as we continue to get through this together.
Thanks, Councilwoman. Councilman Scott Rico, sorry, I didn't see you out there. How you doing, Councilman?
I'm doing well, Mayor. As far as the council goes, yeah, I'm doing the best I can to stay safe. I've been staying home a lot. As far as the council goes, we're in a period where we don't have another meeting for a couple more weeks. We got some, some end of the year duties that we have to take care of and things we need to pass, but that'll be fine. Our next meeting is a week from next Monday, and then the 28th. I think the 14th and the 28th sounds right. Also, I had a question on the parade. If I'm a participant in the parade, is there any other restrictions compared to in the past?
Kevin Smith, could you unmute?
Yes. So, Mayor, I'd be happy to address that, and I'm sure Jim can as well. They are requesting, and we've told them that our staff will help to guarantee that social distancing is taking place even when on the float, that you should wear your mask. If you cannot maintain social distance of 6 feet, you should wear your mask. Those are the guidelines. So just, consider your float kind of a pod. If you guys can maintain social distance on that float, you don't have to wear a mask.
What about candy?
However, candy, Mayor, we kind of I think Donna Muta was going to address that with some of the participants. We haven't prohibited it, but again, you want to maintain distance. So if you're gonna distribute candy, that should be done safely and at a distance.
Throw it far.
Throw it far, but not too hard.
But not too hard.
Hey, anything else, Councilman Rakos?
No, that's really it. Thank you.
Thank you very much. Scott represents Hessville, it's Hammond's 6th district. I want to next go to Hammond's 3rd district, Councilman Barry Tyler. How are you doing, Councilman Barry?
Good, thanks, Mayor. I just want to echo what Councilwoman Alexander said about the holidays. I know a lot of people, sacrifice and didn't spend Thanksgiving with their families, but a lot of people were planning on traveling and doing so for Christmas. I just want to urge people to be cautious and make sure that you are social distancing until then, and quarantining if you are going to see your family members around Christmas, people that don't live in your household already. Outside of that, I also just wanted to call out that I know churches are kind of exempt from the guidelines that the governor has stated. But I do want to just share that, like, if you are sick or if you are in one of those populations that could suffer extreme consequences if you catch the virus, or if you have any like immune system issues that could cause you to be at higher risk of contacting the virus, just be careful. And I know most churches are streaming their services on Facebook or on their websites. I know it's not the same, but just want to urge people to take precaution when it comes to attending church services, especially since they are not bound by the same guidelines that the rest of the businesses are. Thank you.
Thank you, Councilman Tyler. That's a great point you bring up. I want to go back to Corporate Counsel Kevin. I know the governor's order didn't touch churches, but Lake County could, presumably, and I'm not sure if they did touch it, but the way I read this whole situation, what if the Lake County Health Department said, no, I'm shutting churches down as well? How does that work?
So I guess in theory, the Lake County Health Department could tighten restrictions. However, I think we all know what had happened when the governor tried to do that. And there was a little bit of an uproar over separation of church and state type issues and impacting on religious services. In fact, the health department specifically echoed what the governor said, which was religious services are open, but must maintain social distancing and encourage those in high risk areas, as Councilman Tyler indicated, attend online. So
thanks, Kevin. Appreciate it. Good point by Councilman Tyler, Hammond's 3rd district councilman. Before we wrap up, I want to see if anybody else, I know there's a lot of other departments represented here, and I didn't know if anybody had anything they needed to report for this week's meeting. If so, go ahead and unmute or raise your virtual hand or whatever we do on Zoom. Oh, Johnny Perez is raising his real hand, not his virtual hand. Hey, Johnny.
Hi, Mayor. Good morning.
Johnny's the head of, he's the assistant superintendent at Hammond Public Works Department, which is responsible for cleaning our streets, picking up our trash, making sure our city looks nice. So, Johnny, what do you have to report this week?
Since last week, we only have one person with COVID. I just want to bring that up to you.
That's great.
It's okay. But so far, we're okay. We only have one, Mayor.
So as far as pickup and all that, we're on time with our pickup for recycling, for our trash and things like that?
Yes, Mayor.
Okay. Thank you,
we're
Johnny.
all good, man. Thank you.
Appreciate it. Before we wrap up, I want to point out that we learned a lot about essential workers during the first shutdown. One thing I learned is that the people that work in our alleys and pick up our garbage and our recycling are essential as well. That's one thing I think we all have a whole new appreciation for. So pass along our thanks to the men and women that work in your department, Johnny. Anybody else have anything they need to bring up? Again, I want to thank Lori for interpreting for us, and I want to thank all of you for your participation. Our next COVID-19 task force meeting will be same place next Wednesday, 10 o'clock, and I'll see you all then. Take care. Stay safe.